This month's Voices Together installment is an opportunity to meet our 6 newest awardees under Together for Health's Cervical Cancer Grants Program. Together's grants program provides small, highly targeted grants that bring innovative and scalable life-saving prevention services, including vaccination, screening, and treatment, closer to women and girls across low and middle-income countries. This year's awardees are Jhpiego Philippines, KMC Alumni Health Sector, ThinkWell Institute, the Tajik Family Planning Association, DawaMom, and Fundación SalBo. Each of these organizations has received $30,000 to implement a one-year project. Let's hear from the teams themselves.
With that, Jhpiego being a global INGO, but we're saying that we are global, but our heart is local. And then we are local, that we are really would like to support our country move towards cervical cancer elimination. I am a medical doctor, but I am a public health and development management practitioner for like 30 years.
And it was interesting for me to apply our gains, like country gains, in doing social behavior change communication in other programs and see how could those experiences be applied in improving uptake for secondary cervical cancer prevention services.
The intention really is for us to demonstrate the systems, as far as cervical cancer elimination for the national government to scale it up, even at the national level.
My name is Dr. Prajwal Litel and I represent KMC Alumni Health Sector. So it's a non-profit organization of medical and paramedical graduates working all over the Nepal. And the novelty of this project is we are employing the screening via mother-daughter programs and also utilizing the existing network of community health workers in Nepal. So since March 2025, Nepal Government Ministry of Health also started HPV vaccination for the girls aged 10 to 14. So building upon this government program and the ongoing momentum and discussions around cervical cancer prevention, we want to utilize this grant, our organization's resources, infrastructures, network to screen the women in the rural community of Nepal via HPV DNA-based method.
So ThinkWell Institute is a global health organization with a mission to improve health outcomes by transforming health systems and financing.
If you don't target the right policy spaces to speak about such a disease like cervical cancer, to get the right investment right on top, downwards at the county level, then we will not have the gains that we would like to have in the next couple of years.
Do you feel that informing decision makers on investing in highly cost-effective cervical cancer intervention that we all know of, from HPV vaccination to screening and treatment, and especially framing them as global health best buys, as you know they are, that would deliver a very strong, advocacy mechanism for us to ensure sustainable financing for cervical cancer elimination in Kenya. So,
my name is Marifat. I'm from Tajikistan. I'm representing Tajik Family Planning Association. Its mission is to expand access to quality, right-based healthcare and empower women, youth, and vulnerable population to make informed choices about their health and future. Project Jhpiego will strengthen cervical cancer prevention in 2 high-risk areas. It's Rush District and Tursuzoda City, where incidence rates have been risen sharply. This initiative will combine community education, focus group discussions, HPV self-sampling for women aged 30 to 65, and follow-up care for those who testing positive for high risk of HPV type. By pairing awareness raising with practical screening tools, the project aimed to reduce late-stage diagnoses and influence national policy on cervical cancer prevention.
My name is Tafadzo Munzo. I'm a medical doctor by training. I'm executive director of DawaHealth, of course, with DawaMom Foundation. So we started our work about 5 years ago. Initially, it was because of high maternal mortality rates we have in Zambia, and we thought we could use imaging technologies. At the time, we developed a chatbot which was interactive, focused on maternal health. Essentially, use the learnings we got from that initial contraceptive project into cervical cancer. So that's how we developed the DawaMom cervical cancer system we now have. So we're hoping to scale that and continually use imaging technologies and possibly licensing some of the data sets we've created right now. We are looking to license them to other teams that might want to use them to.
Somos Fundación SalBo y luchamos por un mundo donde el cáncer de cuello uterino no arrebate la vida de ninguna mujer.
Soy Berta Liliana Borrero, soy madre, soy mujer, soy abuela y soy sobreviviente del cáncer de cuello uterino. Sé el impacto cruel de esta enfermedad y el dolor tan profundo que deja en una familia. Por eso me prometí que ninguna mujer en el mundo tenga que vivir. De acuerdo, mi fe me sostiene, mi propósito es claro, trabajar sin descanso hasta que el cáncer de cuello uterino sea parte de la historia.
At Together for Health, we're thrilled to celebrate our largest and most geographically diverse group of awardees since we launched the program in 2019. We're looking forward to a year of learning and collaboration with each of these dedicated teams. You can learn more about these organizations and their projects at our website, togetherforhealth.org.